This is Dr. Thomas Klein talking to you from Raleigh, North Carolina. I'm a specialist in rare and chronic diseases. We have had a terrible, terrible crisis in the United States based on our last talk, number 6, that we are estimating 7 million people in the United States have been cruelly taken off existing pain regimens that have allowed them to live normal lives and allowed them to become everyday people. Now we've got 6 million, 7 million pain refugees in a terrible, terrible state. We've been using the term chronic pain patient, CPP, all along. People think people with chronic pain are faking. What's chronic pain? And last time we talked about a list of real diseases these folks have. And I was surprised when I took this little survey, and we do Sidewalk surveys at JATH using Twitter. We have about 30,000 people on Twitter. 90% of them have painful diseases. So it's a unique group of people. No one else in the country has, except we have it at JATH, and we are taking advantage of it. These Sidewalk surveys are not super scientific, but they do give us good information, and if people want to do their own surveys, they are welcome. This is a probe, reconnaissance. We're generally finding out information by Sidewalk surveys. So here's what we found out. I listed all the rare diseases that's in the report that you can find at jatheducational.com. 90% of people with chronic pain responded they have one of these chronic diseases, these chronic rare painful diseases that we discussed last time. EDS, MALS, Lyme's, rheumatoid arthritis, CSF, blah, blah, blah. Lots and lots of diseases. So then we started asking these people in surveys, and we're getting from 5 to 900 responses, looking at the whole group, not just one, not just fibromyalgia, not just interstitial cystitis, but looking at the whole group, we started to ask some questions, and we have some preliminary results that we're going to share with you, because if anybody else out there wants to look at this, they can. And what we are proposing in JATH is this is a new disease umbrella. We have autoimmune diseases, rheumatoid arthritis, lupus, etc., and I think we have a second group of systemic inflammatory diseases, and these are non-autoimmune. So here's what we found so far, and actually it surprised me as a medical researcher because I had never really thought of this before, that all of these people have similar symptoms. Brain fog, when you just can't think. This is typical of fibromyalgia, but it's not. It's typical for all of these diseases. Systemic inflammatory disease is like the first 2 days when you have flu and you're in bed and you can't function. That's what it's like every day for these patients. It is controlled with pain medicines, and one of the things we found out, one of our JATH members, Dr. Robert Prangi up in New Jersey, found out that opiates are anti-inflammatory, of all things. There's actually receptors in the inflammatory tissue. So now we know there's another indication for pain medicines, and that's anti-inflammatory. Brain fog, 92%. How many people find it painful to ride in the car? 92%. Good questions for doctors to ask if they're trying to diagnose this disease. Do you run fevers for no reason? 61% of this group of diseases runs fevers. This means they all have fever of unknown etiology, FUOs. Do you have pain when you roll around in bed at night? 60%. How many of you experience odd or weird reactions to various medicines, including over-the-counter? 3/4, 75%. Now that's really high. And when doctors hear the story that people have had weird reactions to medicines, they pass them off as turkeys. These are not turkeys. These are extremely sick people with incurable disease. So let's stop calling them turkeys and stop calling them drug seekers. How about when people go to a warmer area of the country? 70% said they had a striking improvement in their discomfort levels. And lastly, something that really surprised me, 70% of people in these rare disease categories have migraine headaches. 68%. So next time we're going to talk about the rare diseases and the fact that addiction is rare and compare the two. Thank you.